What if I told you that right now, thousands of seniors over 65 are losing hundreds of dollars every single month to Medicare costs they never saw coming? Last year alone, a Johns Hopkins study found that nearly 64% of retirees underestimated their total Medicare expenses by over $6,000 annually. $6,000. That is not a rounding error. That is real money vanishing from fixed incomes because nobody warned them about the 7 hidden traps buried in the Medicare system. And here's what makes this even more alarming. Financial advisors rarely discuss these costs in detail, leaving you to discover them only after enrollment, when it is often too late to avoid the financial damage. Today, we are exposing every single one of these traps so you can protect yourself before they drain your retirement savings. Let me tell you about Julia. Julia is a 67-year-old retired teacher from Ohio who thought she had done everything right. She enrolled in Medicare on time, chose a plan her neighbor recommended, and assumed her monthly Part B premium was her main cost. 3 months later, she received a bill for $847 for a single outpatient procedure she thought was fully covered. Then came her first prescription refill, $310 out of pocket. Within 6 months, Julia had spent over $4,200 beyond her premiums, wiping out her modest emergency cushion. Now, here is what you need to understand. Julia is not alone, and she is not financially illiterate. She simply walked into the same traps that catch nearly 2/3 of new Medicare enrollees. The Medicare system is deliberately complex, with costs hidden across multiple plans, coverage gaps buried in fine print, and penalties that compound silently year after year. This is not about your ability to understand. This is about a system designed with more holes than coverage, and nobody sitting you down to explain where the landmines are buried. So what exactly are these traps, and why does nobody talk about them? Here is the hidden truth they do not tell you. A comprehensive Kaiser Family Foundation analysis tracking over 12,000 Medicare beneficiaries over 5 years found that average out-of-pocket healthcare costs exceeded $6,800 per year, not including premiums. That is $566 every single month on top of what you are already paying. And for those with chronic conditions, that number jumps to over $10,000 annually. Now, here's what most people get wrong. They hear Medicare and assume comprehensive coverage. They think turning 65 means healthcare is finally handled. But traditional Medicare only covers about 62% of total healthcare costs. 62%. The rest falls on you through deductibles, coinsurance, coverage gaps, and entire categories of care that Medicare simply does not touch. Let me stack the data so you understand the real picture. The average senior spends more on healthcare between ages 65 and 75 than they did in the entire decade before retirement. Prescription costs alone average $240 per month for those on multiple medications. Dental work that was once covered by employer insurance, now entirely out of pocket, averaging $1,200 to $2,500 annually. This is not about Medicare being bad. This is about Medicare being incomplete, and the costs nobody warns you about are the ones that quietly devastate fixed income budgets. But here is the good news. Every single one of these traps is avoidable if you know where to look. In the next few minutes, we are going to walk through all 7 Medicare cost traps in countdown format, from the ones that sting to the one that can truly bankrupt you if you are not prepared. For each trap, we will cover exactly what it is, why it catches people off guard, how much it really costs, and most importantly, the specific steps you can take right now to protect yourself. And when we get to trap number 1, you will understand why so many seniors end up spending down their entire life savings in their final years, even with Medicare in place. But first, do me a favor. Drop a comment right now and tell me this. Are you currently on Medicare, or are you approaching 65 and trying to figure this out? And what is your biggest concern about Medicare costs? We read every single comment, and your input helps us create content that actually answers the questions you are facing. All right, let us dive into the traps, starting with number 7. Trap number 7. IRMAA surcharges. Trap number 7 is IRMAA surcharges that silently inflate your Part B and Part D premiums based on income from 2 years ago. If you earned over certain income thresholds in 2023, your 2025 Medicare premiums automatically increase, not by a little, by hundreds of dollars per month. A recent AARP study found that nearly 8 million Medicare beneficiaries pay these surcharges, but over half had no idea they would be charged until the first bill arrived. Standard Part B is $185 per month in 2025, but if your income crosses certain thresholds, that can jump to over $600 per month. For couples, the impact doubles. How do you protect yourself? First, if you retired recently and your income dropped, file a reconsideration request with Social Security using Form SSA 44. Second, track your modified adjusted gross income closely in the years leading up to Medicare to avoid surprise threshold crossings. The crucial detail? IRMAA recalculations can take up to 90 days, but you still owe the higher premium in the meantime. Budget for it, then get reimbursed later. Now let us move to trap number 6, which compounds every single year you are on Medicare. Trap number 6, Medigap premium inflation. Trap number 6 is Medigap supplemental insurance premiums that increase relentlessly as you age, often doubling within a decade. When you first enroll at 65, the premium might seem reasonable, but a Kaiser analysis found that average premiums increased by 94% over 10 years. By age 75, many seniors are paying double or triple what they started with. Over a 20-year retirement, those compounding increases can add tens of thousands of dollars in total costs. What can you do? First, choose your plan carefully during your 6-month Medigap open enrollment window at age 65, because switching later often requires medical underwriting. Second, compare Plan G and Plan N, which offer nearly identical coverage but with lower premiums and slower inflation rates. The game-changing tip? If you are healthy and budget-conscious, Plan N can save you significantly per month and has shown more stable premium growth in recent years. Next up, trap number 5, the one that hits you hardest when you are already sick. Trap number 5, Part D coverage gap and high drug costs. Trap number 5 is the Part D coverage gap, also known as the donut hole, plus the skyrocketing cost of prescription drugs not adequately covered by your plan. A University of Michigan study found that nearly 1 in 4 Medicare beneficiaries hit the coverage gap annually, and when they did, their out-of-pocket costs jumped dramatically in a single year. Once your total drug costs hit a certain threshold, you enter the gap. You will pay a significant percentage of the cost for brand-name drugs until you reach the catastrophic coverage limit. For those on specialty medications, this can mean hundreds or even over $1,000 per month during the gap period. What can you do? First, during annual enrollment, compare Part D plans using Medicare's Plan Finder tool and enter your exact medications. Second, ask your doctor about therapeutic alternatives or generics. Third, explore manufacturer assistance programs and state pharmaceutical programs. The crucial detail? Some Part D plans have lower deductibles and better coverage in the gap. Paying slightly more per month in premiums can save you thousands during the coverage gap if you take expensive medications. Now we are getting into the traps that carry permanent financial penalties. Let us talk about trap number 4. Trap number 4, late enrollment penalties that never go away. Trap number 4 is lifetime late enrollment penalties that add 10% or more to your premiums for every 12 months you delay, and they never disappear. Many people think they can delay Medicare Part B if they are still working and covered by an employer plan. That is true, but only if your employer has 20 or more employees. A government audit found that hundreds of thousands of seniors have paid billions in late enrollment penalties, mostly because they misunderstood the rules around employer coverage. The Part B penalty is 10% of the standard premium for every full 12-month period you were eligible but did not enroll. If you delay 3 years, that is a 30% surcharge for the rest of your life. Over the decades, this adds up to tens of thousands in unnecessary penalties. How do you protect yourself? First, enroll during your 7-month initial enrollment period around your 65th birthday, unless you have creditable coverage. Second, get written confirmation from HR that your employer coverage qualifies as creditable. Third, when your employer coverage ends, you have only 8 months to enroll in Part B without penalty. One game-changing detail: COBRA does not count as creditable coverage. If you lose your job and go on COBRA, you must enroll in Medicare immediately or face penalties. We are halfway through. If you are finding this helpful, do me a favor and hit that like button. It helps us reach more seniors who need this information. And make sure you are subscribed to notifications on, because we are constantly breaking down the financial traps and scams that target seniors, the stuff your financial advisor is not telling you. We are here to make sure you keep every dollar you have worked so hard to save. All right, let us keep going, because the next 3 traps are the ones that truly shock people. These are the costs that feel like betrayals because you assumed Medicare covered them. Trap number 3 is the complete exclusion of routine dental, vision, and hearing care from traditional Medicare, forcing you to pay 100% out of pocket. A National Council on Aging study found that 68% of Medicare beneficiaries incorrectly believed Medicare covered dental work, and 54% thought vision care was included. It is not. Original Medicare covers nearly 0 routine dental, vision, or hearing services. The average senior spends $1,240 annually on dental care alone. Need a crown? That is $1,000 to $2,500. Root canal? $800 to $1,400. Dentures run $2,000 to $8,000. Hearing aids cost $2,500 to $6,000 per pair. Premium lenses for cataract surgery? Not covered. That is another $2,500 per eye. What can you do? First, consider a Medicare Advantage plan. Many include some dental, vision, and hearing coverage. Second, purchase standalone dental insurance during your initial enrollment. Third, explore dental schools and community health centers for discounted care. The secret detail? Some credit unions and organizations like AARP offer discounted dental plans that provide negotiated rates, sometimes saving 20 to 40% on major procedures. Trap number 2 can cost you tens of thousands in a matter of weeks. Trap number 2, hospital readmission costs and observation status loopholes. Trap number 2 is the observation status loophole that leaves you paying thousands, even when you think you are admitted. Here is what happens. You go to the hospital, you stay overnight, maybe 2 nights. You assume you were admitted as an inpatient, so Medicare Part A covers it. But then you get a bill for $8,000, and you discover you were under observation status the entire time, which is billed under Part B with a 20% coinsurance that you owe. A Yale School of Medicine study found that more than 1.6 million seniors per year are placed in observation status without realizing it, and the average out-of-pocket cost is $3,400. Observation stays are billed at 20% coinsurance with no cap. A 3-day observation stay can easily generate a $5,000 to $9,000 bill. Even worse, observation days do not count toward the 3-day inpatient requirement for Medicare-covered skilled nursing care afterward. What do? First, always ask hospital staff directly. Am I admitted as an inpatient or am I under observation? Get it in writing if possible. Second, if placed under observation and you believe you should be admitted, you can appeal through a quality improvement organization. Third, a Medigap plan covers the 20% coinsurance. Fourth, document everything and keep every notice Medicare sends. Here is the game changer. The 2 midnight rule states that if your doctor expects you to need hospital care spanning 2 midnights, you should be admitted as an inpatient. Know this rule and advocate for yourself. And now we have reached trap number 1, the single biggest Medicare cost that devastates more families financially than all the others combined. Trap number 1, long-term care costs not covered by Medicare. Trap number 1 is the catastrophic cost of long-term care, which Medicare does not cover, and which can drain a lifetime of savings in under 3 years. This is the trap that shocks people the most because the assumption is so widespread. A nationwide survey by the American Association for Long-Term Care Insurance found that 72% of pre-retirees incorrectly believed Medicare would cover long-term nursing home care or in-home assistance. It will not. Medicare covers short-term skilled nursing after a qualifying hospital stay and only for up to 100 days. After that, you are on your own. And here is the reality. The U.S. Department of Health and Human Services estimates that 70% of people turning 65 today will need some form of long-term care during their lifetime. Now let me show you how much this really costs. The national median cost for a private room in a nursing home is now $9,733 per month. That is $116,796 per year. For a semi-private room, it is $8,669 per month, or $104,028 annually. Assisted living averages $4,500 per month. In-home health aides cost $30 to $35 per hour. If you need 40 hours of care per week, that is $5,200 to $6,067 per month. A Genworth study tracking long-term care costs over 15 years found that the average nursing home stay is 2.5 years, meaning total costs often exceed $250,000 per person. So how do you protect yourself? First, understand that Medicaid, not Medicare, covers long-term care, but only after you have spent down nearly all your assets to qualify. Second, consider long-term care insurance in your late 50s or early 60s when premiums are more affordable. Waiting until 70 makes it prohibitively expensive or unavailable. Third, explore hybrid life insurance policies with long-term care riders, which provide a death benefit if you never need care. Fourth, have honest family conversations now about care preferences, financial resources, and who will manage decisions if you become incapacitated. Fifth, investigate whether your state offers a partnership program which protects some assets if you buy qualifying long-term care insurance and later need Medicaid. The crucial detail nobody talks about? If you purchase long-term care insurance, buy a policy with inflation protection. Without it, a policy that covers $150 per day today will be nearly worthless in 15 years when costs have doubled. So where does this leave you? Here is what I want you to take away from this. These 7 Medicare traps are real. They are costly. And yes, they catch thousands of seniors off guard every single year. But you are not helpless. The fact that you watched this video all the way through means you are already ahead of the majority. Knowledge is protection. Action is power. Medicare is not broken, but it is incomplete, and the costs nobody warns you about are the ones that quietly erode the retirement security you have spent decades building. But now you know where the landmines are buried. You know the questions to ask. You know the steps to take. And that changes everything. This is not just about saving money. This is about preserving your independence, protecting your choices, and making sure that the healthcare system works for you instead of against you. You have earned the right to age with dignity and financial security. Do not let hidden costs steal that from you. Now I want to hear from you. Which one of these 7 traps caught you most off guard? Or which one are you most concerned about as you approach Medicare age? Drop a comment below. We read every single one, and your questions help us create the content that truly serves you. And if you found this helpful, share it with someone you care about who is navigating Medicare. This is the information everyone deserves to have before they enroll. Thank you for watching. We will see you in the next one.